What is going on, lovely people? This is Medicosis Perfectionalis, where medicine makes perfect sense. Let's continue our physiology playlist, and today we'll start a new section. It's time to talk about blood cells and immunology. With that said, now let's get started. Today is video number 61 in this playlist. So, from the first video until 25, we talked about an introduction, osmosis, dawn and equilibrium, Fick principle, etc. From 26 to 40, we talked about the autonomic nervous system. From 41 to 50, nerve physiology and the action potential. 51 to 60, muscle physiology. From 61 to 70, we'll talk about blood and immunity. Today is video number 61. Please watch them in order. A quick note, our discussion on blood will be very brief. Why? Because I have separate playlists for hematology and coagulation respectively. If you want to learn about all the anemias, all the leukemias, the lymphomas, all the hemophilias, von Willebrand disease, all kinds of stuff, check out these playlists here on YouTube. Let's do the review. Blood. Blood is made of what? Plasma and blood cells. Function of blood: transport, defense, homeostasis, hemostasis. What's the difference? Hemostasis means to stop bleeding. Stasis, stable. Hemo, blood. Stop the blood from being lost. Stop the bleeding, i.e. blood clotting and coagulation. Homeostasis is keeping the internal body environment constant. We also need to transport all kinds of stuff, especially the red blood cells, because they will transport oxygen and carbon dioxide. Defense: this is the white blood cells. Your blood is made of plasma and cells. The plasma is made of water and proteins. The proteins are many, including albumin and globulin. We also have the coagulation factors such as fibrinogen, prothrombin, and others. Albumin protein is very small but numerous. You have tons of albumin all over the blood. Globulin is the opposite, large. That's why it's called globulin, because it's globular, it's big, it is spherical, and less numerous. What does IN mean? Usually a protein. Albu, because alb means white. So albumin literally means the white protein. And globulin means the globular protein. Globulin is divided into alpha globulin, beta globulin, and gamma globulins. Alpha globulins include alpha-1 antitrypsin and angiotensinogen. Beta globulins are the coagulation factors and transferrin, the plasma protein that carries iron. Gamma globulins are your antibodies or immunoglobulins such as IgM, IgA, IgG, IgE, IgD. And then we have the cells: red blood cells, white blood cells, platelets. Red blood cells are counted in millions per milliliter. How about white blood cells? Thousands. Platelets, hundreds of thousands. What's the function of plasma? Lots of function, including transport. Function of cells: red blood cells carry oxygen and carbon dioxide for breathing of your cells. Hashtag cellular respiration. White blood cells defend your body against foreign invaders. Platelets, they are the thrombocytes. They make thrombus. They clot and stop the bleeding. Low red blood cells is called anemia. Low number of white blood cells is called leukopenia. Low platelets, thrombocytopenia. If I have anemia, I'm tired and pale and tired. If I have leukopenia, I get infections. If I have thrombocytopenia, I bleed. Let's talk about the plasma. As you know, the plasma is mostly water. And water in your body is 60% of your total body weight. And the water in your body is either intracellular, most of it, or extracellular. The extracellular could be available in the plasma or in the interstitial space. Some of the water is also transcellular inside cavities. But forget this, let's talk about the plasma. The average person has about 3 liters of plasma. Where did you get the number from? They did these studies on young military men. The average man back in the day was about 70 kilograms. Today we are heavier because we eat lots of chips. Anyways, if this meal is 70 kilograms, how much water is in that body? It's about 2/3. 60% times 70 equals about 42 liters of water in your body. This 42 liters is divided into 2/3 and 1/3. So this is about 28 liters and this is about 14 liters. And then 1/4 of the 14 is in the plasma. So this is about 3.5 liters. Let's just call it 3. You have 3 liters of plasma and 2 liters of red blood cells. Therefore, your total blood volume in your body is about 5 liters, give or take. Plasma is made of water. Most of the plasma is water. Moreover, we have inorganic substances, organic substances, and gases. Gases are easy: oxygen, carbon dioxide, etc. Organic substances are plasma, proteins, plasma, lipids, and miscellaneous stuff. What are these inorganic substances? You have cations and anions. Cations, sodium, potassium, calcium, magnesium. Which one is the most important and the most prevalent and abundant? Sodium. That's why your kidneys love sodium. They are always playing with sodium. How about the anions, the negative charges, negative electrolytes? You have chloride, bicarbonate, phosphate, sulfate. Which one is the most abundant? Chloride. Sodium chloride make a great couple. Plasma proteins include what? Albumin and globulin, and others such as fibrinogen, prothrombin, and all of the coagulation factors, or most of them. Plasma lipids such as cholesterol, triglycerides, phospholipids. When you add lipid and protein together, you get lipoproteins or proteolipids. And there is some miscellaneous stuff such as glucose, amino acids, and vitamins. Now, let's just focus on the plasma proteins. Plasma proteins, you have albumin, globulin, these are the main ones, and then fibrinogen, prothrombin, and the other coagulation factors. All of this lovely stuff is made in the liver, except gamma globulins, which are subtypes of globulin. What are these gamma globulins? They are the antibodies, the immunoglobulins. Who makes them? The plasma cells. Where did it come from? It's a mature B lymphocyte. Where did the B lymphocyte come from? They originate in the bone marrow. They mature in the bone marrow. You can also find them in lymph nodes, spleen, tonsils, and other lymphoid organs. Now, let's talk about just globulin. Globulin, baby, has 4 subtypes. You have alpha-1 globulin, alpha-2 globulin, beta, and gamma. If I take all the albumins and globulins from your body and plot them on a graph right here using electrophoresis, you'll see that the most abundant protein in your plasma is albumin, followed by globulin. And then the globulin is alpha-1, alpha-2, beta, and gamma. Normally, albumin is way more numerous than globulin. Give me an example of alpha-1 globulin, alpha-1 antitrypsin. And to know about alpha-1 antitrypsin deficiency disease, check out my pulmonology playlist here on YouTube. Alpha-2 globulin is angiotensinogen, which was discussed ad nauseum in my renal physiology course on my website, medicosisperfectionalis.com. This is the story of the renin-angiotensin-aldosterone system. Then you have your beta globulin. These are the coagulation factors and transferrin, which carries iron. And you have the gamma globulins. These are your antibodies or immunoglobulins. And the mnemonic is MAGID or MAGID. So IgM, IgA, IgG, IgE, and IgD. MAGID is a boy's name that you can find in North Africa, the Middle East, Iran, etc. What are the coagulation factors? We have talked about them before in my playlist called Bleeding and Coagulation. All of them are globulins, especially beta globulins, with the exception of number 4. Coagulation factor number 4 is calcium. It's not a protein. Albumin to globulin ratio. Normally, albumin in your blood is about 4. For what? 4 grams per deciliter. Thank you so much. And normally, globulin in your plasma is about 2.5 grams per deciliter. That's a concentration. 4 over 2.5 gives you about 1.6. And this is called albumin to globulin ratio. Normally, it should be between 1.2 to 1.6. So that's the normal. How about the pathology? If you see this ratio very low, lower than 1.2 or 1.1, you should suspect something going on. Why would this ratio be low? It will be low because albumin is decreasing and globulin is staying the same, or albumin is decreasing faster than globulin. And you see this in liver disease and kidney disease. Cirrhotic Nephrotic. On my channel, there's a video called Nephrotic Syndrome, and in this video, I've told you why do we get hypoproteinemia, which means low protein in the blood. It's either you're not eating protein, malnutrition known as Kwashiorkor syndrome, or you're not making protein, liver failure, this is the cirrhotic part, or you're losing your protein. You could be losing it in the stool or losing it in the urine. Losing it in the stool could be malabsorption syndrome or Menetrier's disease. Losing it in the urine, it's nephrotic syndrome. All of these will lead to low proteins, especially albumin, and they can lead to a low albumin to globulin ratio, especially cirrhotic and nephrotic syndromes. When you lose the protein, especially albumin, you lose your oncotic pressure, and then plasma will start leaving your vessels and go to the interstitial fluid, which is part of the extracellular fluid, and you will swell. You will get edema like this. Functions of plasma protein. Let's go. A, B, C, D, O, T. Amino acid source for tissue, buffering, blood viscosity, coagulation of blood, capillary function, defensive function, osmosis and transport. What do you mean by amino acid source? Remember, plasma proteins are proteins, yeah. If for any reason you need some amino acids, you can break those proteins down and get your amino acids. Buffering. This H is nasty. Acidosis is dangerous to your body. You can buffer this proton against those plasma proteins. Blood viscosity. Your plasma is about 1.5 times as viscous as water. How come? It's the plasma protein's job. Why is high blood viscosity important? It's important to maintain a robust peripheral resistance, which will maintain a good blood pressure. If your viscosity is too low, you can get hypotension. If your viscosity is so high, it causes stasis, which increases your risk of coagulation. Remember the Furco's triad? We had endothelial damage, blood stasis, and hypercoagulability. Next is coagulation. This is called secondary hemostasis, and you need the coagulation factors, which are beta globulins. Capillary function, because these proteins can close the capillary pores and adjust the vessel permeability. Your antibodies or immunoglobulins have defensive function, and these are your IgM, IgA, IgG, IgE, and IgD. Osmosis, especially albumin. Albumin is responsible for the oncotic pressure. Here's the deal. If you want a pressure that pushes stuff out of the vessel, it's called hydrostatic pressure. If you want a pressure that pulls fluids towards the vessel, this is an oncotic pressure. Who's responsible for the oncotic pressure? Albumin, baby. Why albumin? Why not globulin? Because osmosis cares about the number, not the weight of the molecules. Since osmosis cares about the number of particles, albumin wins because albumin is more prevalent and abundant and numerous in your plasma. See, medicine makes so much sense once you understand what the flip you're talking about. To learn more about osmosis, check out the early videos in this physiology playlist. Transport of what? All kinds of stuff. Albumin, for example, can transport calcium. The globulins can transport the hormones, such as thyroid hormones, cortisol, estrogen, and other sex hormones, testosterone. We're done with the plasma. Let's talk about blood cells. Red blood cells, circular, biconcave, and non-nucleated. They have no nucleus. Lifespan, they should live in your circulation for about 120 days. Why is this important? It's extremely important because these red blood cells contain what? Hemoglobin. Part of that hemoglobin is sugary. We call it the glycated hemoglobin or hemoglobin A1C. If I have diabetes, my doctor will check my hemoglobin A1C. Why? Because this tells the doctor how my blood sugar has been doing over the past 3 to 4 months. Where do we get 3 to 4 months from? It's the lifespan of the red blood cells. Again, everything makes sense. Red blood cell count is usually higher if you're a neonate, an athlete, or someone who lives on top of a mountain. Why? Because these people have too much EPO, erythropoietin, which tries to make the erythrocytes, which are your red blood cells. Erythro means red. Red blood cells are made of hemoglobin. Hemoglobin is made of heme and globin. Heme consists of iron and protoporphyrin. Protoporphyrin becomes biliverdin, and then it becomes unconjugated bilirubin, which goes to the liver to get conjugated. What's the function of EPO? It's to tell the bone marrow to boost red blood cell production. What will stimulate EPO? Let's say you have anemia. Oh, anemia, that's dangerous. Let's get more EPO, especially from the kidney, and EPO will tell the bone marrow, hey bone marrow, why didn't you make more red blood cells? Because we have anemia, we actually need more. Sure, let's do it. But what if I have a disease where EPO is low? Well, you will have less stimulation to the bone marrow and less red blood cell formation. You'll get anemia. Because remember, all of your blood cells, whether they are red, white, or platelets, are made inside the bone marrow. Pluripotent stem cells in the bone marrow can make all kinds of blood cells. They make the red blood cells, they make the platelets, and they make the white blood cells. Pause and review. If you want more discussion about this, check out my hematology playlist. When you go to the doctor can order a complete blood count or CBC to see what? Red blood cell count, which is the number of red blood cells per unit volume, usually per microliter. Normally in females should be between 4 and 5 million per microliter. You can write it this per microliter or like this per liter. Males usually have a higher red blood cell count thanks to testosterone, so it's between 4.5 to 6, written this way or this way. Another thing is the hemoglobin concentration. As you know from the Fick principle, amount equals volume times concentration. Therefore, concentration equals, well, amount over volume. All right, amount is grams, volume is deciliter. That's why we will use this measuring unit. In this lovely test tube that contains your blood, what's the concentration of hemoglobin? This is what we're trying to figure out. In females, 12 to 15. In males, 14 to 17. If you just want to memorize, females should be 14. Males should be, let's say, 16. This varies from country to country. It's probably due to nutrition. Because remember, red blood cells have iron in them. If you are malnourished, you're probably going to have a lower hemoglobin concentration number. Next is the hematocrit, or the packed cell volume. Put your blood in a test tube. Red blood cells will go here to the bottom. Plasma will stay on top. We would like to get a ratio between the numerator and the denominator. What's the numerator? Volume of the red blood cells alone. Over what? Volume of the plasma? Shut up! Over volume of the entire blood, all of the test tube. So here, if this is 45 and this is 100, this will be 45 over 100 or 45%. This is the normal hematocrit in males. In females, it's about 40%. Who makes my red blood cells? Bone marrow, especially myeloid stem cells. And then we go from here to here. The baby red blood cells are called reticulocytes. The mature ones are called erythrocytes or red blood cells. Who is stimulating this process? EPO. Let's talk about white blood cells. Basophils, eosinophils, neutrophils, monocytes, lymphocytes. The first three are called granulocytes. These are non-granulocytes. Why? Because they don't have granules, but these ones have granules. If you have granules, you are granulocyte. Some granules are acidophilic or eosinophilic because they are pink. Others are basophilic. That's why we call it basophil and eosinophil. Other cells have neutral granules. That's why we called it the neutrophil. White blood cells have a nucleus. However, red blood cells do not have a nucleus. Platelets are not even cells. They are pieces of the megakaryocyte. All of your blood cells came from pluripotent stem cells. Some textbook will say multipotent, but I like pluripotent better. I think it's more accurate. Leukocyte. Cyte means cell. Leuko means white because they appear as white here in this thin buffy coat. This buffy coat contains white blood cells and platelets. The plasma is here, red blood cells are here. Next, the platelets, aka the thrombocytes. They make a thrombus. What's the normal platelet count? Between 150,000 to 400,000 per microliter. Platelets are here in the buffy coat. Low number of platelets is called thrombocytopenia, and you get what? Bleeding. Increased number of platelets is called thrombocytosis or thrombocythemia, and you are more likely to clot. Do you consider these platelets to be actual cells? No, they are pieces. Pieces of what? Pieces of the grandmother megakaryocyte. May she rest in peace. The grandmother, the megakaryocyte, was alive and floating freely in the blood. Suddenly, boom, it exploded onto all kinds of platelets. Each platelet takes a piece of the membrane of the megakaryocyte and a piece of the cytoplasm of the megakaryocyte. When did the explosion happen? The explosion happened when the megakaryocytes were trying to leave the bone marrow and go to the blood. And that's why if you do a bone marrow biopsy to look inside the bone marrow, you will see the grandmother, megakaryocyte. You will not see platelets. Platelets are only seen in the peripheral smear most of the time. Where do we find platelets? In the peripheral blood, and lots of them are hiding in the spleen. That's why if I have splenomegaly, more platelets will be hiding in the spleen, less platelets will be available in the peripheral systemic circulation, and that's why splenomegaly is related to thrombocytopenia. Who stimulated red blood cell production? It was called EPO, erythropoietin. Who will stimulate platelet production? TPO, thrombopoietin, which stimulates the thrombocytes. Who makes TPO? The liver. Who makes EPO? Mostly the kidney. The lifespan of the red blood cell was 120 days. Of the platelets, it's just 8 to 12 days. Who makes them? The bone marrow. Who removes them? The splenic macrophages. Pause and review. Question of the day. Here we have the results of serum protein electrophoresis. And as you know, there is albumin, alpha-1 globulin, alpha-2 globulin, beta-globulin, gamma-globulin. We would like to see which of these will occur in a patient who has type 4 renal tubular acidosis, knowing that the normal looks like this. Is it A, B, C, D, or E, or F, or G? Let me know the answer in the comment section. You'll find the correct answer in the next video. I have a separate course on renal physiology available on my website, medicosisperfectionalis.com. It comes with 10 videos, 10 cases, notes, and my Perfectionalis Ultimate Notebook. And for a limited time, you can get a 40% discount towards anything on my website. Just use discount code KIDNEY at checkout. Thank you so much for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here. Go to my website to download my courses. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.